Welcome to the first course of CWC, the diabetes course, and I'm happy to lead it. My name is Dr. Archana Bindra. I'm a board-certified endocrinologist and board-certified in lifestyle medicine. Lifestyle medicine in the past 2 to 3 years has become an important part of clinical medicine, and we have been able to incorporate it into our course. The objective of this course is to design it in a very simple manner so that it is easy for the layman to understand and to be able to understand the principles of lifestyle medicine and to incorporate it into their daily life. There are several components of this course. I will be speaking on the first two, that is Diabetes 101 and the why of lifestyle medicine along with SMART goals and exercise. Diabetes 101. It's very important to understand the condition that you have if you would like to reverse it and make it go away. So in the next 15 or 20 minutes, I will be telling you all about diabetes. So what exactly is diabetes? So essentially, glucose comes into your body from the food that you eat. And insulin is the hormone that is released that pushes that glucose into the cell, and the glucose then eventually gives you the energy. There are different types of diabetes. For the most practical purpose, there are 3 types. There's type 1 diabetes, type 2, and gestational diabetes. Type 1 diabetes in about 10% of the population, where the body does not produce insulin at all. In type 2 diabetes, it's about 90% of the population where the body produces insulin, but it's not efficiently or sufficiently used. And gestational diabetes is a diabetes that you find in pregnancy. Now, diabetes can be reversed especially with type 2 diabetes. So what is the difference between type 1 versus type 2 diabetes? So in this figure to the left is your pancreas, and the glucose is released, but the insulin from the pancreas is not released at all in type 1. And therefore, this glucose is not able to enter the cell at all. It doesn't act on its receptors, and it's not able to, it floats around in the system and its levels go on increasing. Whereas in type 2, you do have the insulin that's released from the pancreas. However, the insulin is not sufficient and it's not efficient enough to push that glucose into the cell, and therefore that glucose lingers around. So how do we regulate glucose in our body? There's high blood glucose and there's low blood glucose, but the body wants to keep it all in equilibrium. And the organ that helps us out is the pancreas, which releases insulin by the beta cells, and it releases glucagon from the alpha cells. So when there's high blood glucose, the insulin from the pancreas is released from the beta cells, which pushes that glucose into the muscle and into the fat cells where it belongs. And that brings it back to a normal blood glucose level. When there's a low blood glucose, the pancreas releases glucagon, which is exactly the opposite of insulin. And that stimulates the liver to take up that glucose, and that brings to release glucose into the system, which brings the glucose levels back up to normal. So when were you really diagnosed with diabetes? You were diagnosed on the x-axis of this graph is years of diabetes. On the y-axis, you see the relative beta cell function and plasma glucose. Now, when I'm talking of beta cell function, I'm talking about beta cells from the pancreas. They're the ones that secrete the insulin. Now, if you look at the point 0 on the x-axis, that's at the point when you actually develop diabetes. And when you do develop diabetes, you've noticed that your beta cell function, the one in red, is actually already dwindling. You've lost 50% of your beta cells, and your insulin resistance has already begun to rise. The first level that rises is a post-meal glucose, which most people actually would believe it would be the fasting. However, it's the post-meal sugars that go up first and the fasting goes up later. So how does one know whether their sugars are in good range or not? And that is a hemoglobin A1C. A hemoglobin A1C is an average of your blood sugar readings, and it's taken over every 3 months. So a hemoglobin A1C, the lower the number, less than 6, is considered extremely good. As you go higher, it gets worse and worse, and it corresponds to a different blood sugar level. So higher the hemoglobin A1C, greater the complications of diabetes that are noted. As you can see in this graph, on the x-axis is the A1C, and on the y is its relative risk. And you can notice that the 4 complications of retinopathy, nephropathy, neuropathy, and microalbuminuria. So retinopathy is the eyes, nephropathy would be the kidneys, neuropathy would be the nerves of the feet, the hands, and microalbuminuria, meaning that there's protein being secreted in the urine. And all of these start creeping up as A1Cs get higher and higher. The diagnostic criteria for diagnosing diabetes, the normal would be less than 5.7. A pre-diabetic is between 5.7 to 6.4. And when you have diabetes, it's greater than 6.4, or in fact, some cases it's given as 6.5. Fasting plasma glucose is extremely important. The levels between 100 to 126 are considered as impaired fasting glucose, and the level between 140 to 199 is called impaired glucose tolerance. And both of these are associated with heart disease. So it's extremely important to keep our sugars under well control. So what exactly happens in diabetes? The main defects lie in the liver and the muscle. The muscle doesn't take up the glucose, as well as the fat cells do not take up the glucose. The liver produces a lot of glucose, and that causes the rise in sugars. And the pancreas secretes insulin. However, it's not sufficient or it's inefficient in its use. And all of these three together, they cause hyperglycemia or high blood sugars. So there is a factor called insulin resistance. And what is that? So insulin is needed for glucose to enter into the cell. And as you can see, insulin is the key for that glucose to go into that cell. And the entrance of that cell where the key fits into the hole, if it's all clogged up, the insulin doesn't fit into the keyhole and the glucose doesn't enter the cell. And that clogging occurs from a high fat diet, high cholesterol, and other things that makes it difficult for insulin to work well, including obesity, where you have a lot of insulin resistance. So insulin resistance is more of a vicious cycle. It starts from lack of insulin made by the pancreas or insulin that's made, which is very inefficient. The cells don't take up the insulin very well. The sugar gets stored as fat, and a person starts feeling tired and hungry. Well, guess what? The person goes and eats food. They go and drink sodas. They drink juices. They're always in terms of drinking and eating in order to make themselves feel better. And that creates a vicious cycle of making more insulin, which is not very useful. Hyperglycemia is when you have high blood sugars, and high blood sugars greater than 180 is because that's when it starts getting spilled into your urine. And the symptoms that you feel are feeling very thirsty. You want to go to the bathroom all the time. You have this extremely dry skin. You're tired all the time. Your vision is blurry. You're very hungry. And of course, if you have infections, they don't heal as quickly as they should. So it's so if you start developing any of these symptoms, then you might want to start checking your sugars, because that would tell you that it may be well above the range that it should be. So on the other hand, what are low blood sugars? So a low blood sugar of 70 or below, you start feeling really tired, shaky, sweaty. Some people get anxious, they have blurry vision, headaches, nervous, their heart starts beating. And all of these are indications that their sugar might be too low. So why do we worry about these high blood sugars? Because there are complications related to diabetes, as was mentioned before. And blindness is the leading cause. Diabetes is the leading cause of blindness. That's one of the major complications, is diabetic retinopathy. The other one is diabetic nephropathy, leading to end-stage kidney disease and people ending up on dialysis. Diabetic neuropathy is when you have tingling and numbness of the lower extremities and loss of sensation. And very frequently, this leads to gangrene and to amputations. The two Major vessels that get involved are the brain and the heart. We call them macrovascular, where they're larger vessels and people end up with strokes or they end up with heart attacks. So diabetes can cause microvascular complications and macrovascular, as in large vessels. So now when we talk of an A1C, and if we only knew the number and you went to a doctor and it was found that you were at 7% can present in very many different ways. The first one on the left shows that you're still at 7, but you'll notice that you have 40% are high, 40% are in range, and 20% are low, but your A1C is still 7. The middle one shows that you are 70% in range, you're 25% high, and you have some lows, but you're still at 7. And then when you're all between the two blue lines, the dotted lines, and everything is perfect, you're 100% in range and your A1C is 7. So that 7 tells you that your average blood glucose is about 154, but it doesn't really tell you very much else than that. So it's extremely important to monitor blood sugars at home. We used to monitor blood sugars a lot more with a glucometer on the left, where you would poke your finger, put the blood on the machine strip, and it would tell you a reading. Well, nowadays, we have come up with continuous glucose monitoring systems, and there are couple of companies that actually use them. One is the Freestyle Libre sensor, which is from Abbott, and the second one is the Dexcom. The one that I have here is the Freestyle sensor, and it shows that you can apply a small round circular patch on the surface of your arm. It does go in with a little plastic tubing, which is the sensor that acquires all the data, and it works either with your cell phone or it works with a little tiny machine that they call a reader. And all you do is swipe it over the arm, as is shown in the picture, and it would give you the numbers like you notice on the screen. So when we do finger sticks, we miss the highs and the lows. The extreme lows, as you can see, which are red marks, and the extreme highs, which are in the yellows, you would miss them if you only checked yourself 4 times a day. The green ones are where the finger sticks are done. And you notice that they are not showing that you're completely out of range. So if you only did that, you would think that your blood sugars are pretty well controlled. So a classic CGMS sensor, which is a continuous glucose monitoring system, is the little patch that goes on top of the skin, which was that yellow, whitish round disc, which was the size of a quarter. And it has a little glucose sensor, as you can see the needle sticking into the skin. And that goes into what we call interstitial fluid. It grabs all these blood sugar readings from the interstitial fluid, and that's what gives you the blood sugar reading. Now, when we poke our finger, what we're getting is capillary blood. And that capillary blood, so food initially, when it goes in the system, it first goes to the capillary blood, and then it goes into the interstitial fluid. So sometimes the continuous glucose monitors, I mean, they're very good and they've come a long way, but they do follow the capillary blood. So you're always going to see a little bit of a discrepancy, but it's still very, very helpful. So this is a typical CGMS report. This is somebody who, on the right-hand side, you can see in the yellow, has 23% highs. He's in target range about 47% of the time, and is very high in about 20% of the time, and has some lows. So when we look at this graph, the dark blue in the center is pretty much where this person is most of the time. Now, there is a lot of variability, which means that the blue goes into light blue and so forth, which shows that this person can range anywhere from way down in the 70s or 60s and be as high as somewhere close to 300 and even somewhere beyond 350 sometimes in the day. But what it really tells you that he's somewhere in the middle. And as you see, he's very high after his breakfast, presumably at about 7 a.m., and then stays high through the day, and then is very high again at somewhere about 7 or 8 p.m. And then the bottom graph tells you what he is on different days of the week. And so this gives us a pattern of how these people are. What does he eat all day? How does he have any lows? And so forth. It also tells me that he has a 7.6% A1C, which all the low blood sugars, all the high blood sugars that he has. So it gives you a lot of data to what you need. And it's also very, very helpful in catering to what you might have eaten or the carbs that you ingested, because it would tell you what happens to your blood sugars. I have some questions here that might recapitulate what we talked in this talk and make you understand better the different concepts which you could go through. They are very important and they'll be very helpful.
Thank you, Dr. Archana, for enlightening us on the important aspects of Diabetes 101. We hope our viewers have enjoyed and embraced this segment as much as we have enjoyed presenting it to you all. Now let's move on to the next segment of the course, where Dr. Archana will tell us about lifestyle medicine, SMART goals and exercises. We wish all the participants good luck and encourage you to watch all the videos for a comprehensive understanding of all the topics and engaging in the activities provided in the course. Happy viewing!